Chairperson, Vice Chancellor, ladies and gentlemen. Let me present actually a small part of the study that we are doing at the moment at Reproductive Biology Laboratory on varicocele patients. The topic of the today's presentation: can varicocelectomy improve the seminal fluid parameter abnormalities? So, step into the topic. So, I want to give you an introduction. 15% of married couples suffer from subfertility. It's a common health problem, even though hidden. Then, out of this 15%, 50% of subfertility is due to male factor infertility, then another 15 male and another 30 for both. Then the varicocele is one of the common causes of male subfertility out of this 50%. Then the other most important thing, varicocele is considered as one of the common surgical correctable causes of subfertility. That means the varicocele can be corrected surgically. Then the prevalence of varicocele is about 15%, but in Sri Lanka the prevalence is still not known. Then approximately 40% of varicocele male with the primary subfertility and 80% of male with secondary subfertility are found to have varicoceles. Then the exact prevalence of varicocele among Sri Lankan male population is still not known. Then what is varicocele? It's abnormal dilatation and tortuous of the pampiniform plexus, venous plexus of the spermatic cord, chiefly affecting the internal spermatic vein. So that's the varicocele. So you can see it as a dilated veins at the neck of the scrotal sac. So it's a diagrammatic representation of the pampiniform plexus. So varicocele means a dilatation and stasis of blood within this venous system. So 80% of varicoceles are unilateral and left-sided, and the 15% are bilateral, and right side varicoceles are very rare. Then varicoceles can be divided into 4 groups. First degree, palpable only during Valsalva maneuver. That means straining only you can palpate the dilated veins. Then the second degree, palpable only at upright position. So patient, in the upright position you can palpate without asking patient to strain. Then the third degree, visible as a worm of bag. It's visible. Then the subclinical, you can't detect the varicocele, but if you do ultrasound scanning or duplex Doppler, you can clearly see the dilated vein. So that is the subclinical type or the 4th category. Then there are a lot of theories or the etiology of varicocele. These are the theories which have been published in various articles. Incompetence of the venous valve, hydrostatic pressure differences at the left and right vein, because anatomically left vein drain directly into the renal vein, then the right directly into the aorta. Then the increased nitric oxide in the testicular vein. Then the increased blood flow of the testicular vasculature during puberty. So these are the reasons. And recently they have correlate varicoceles with the Y chromosome microdeletion. That means genetic factors, but it has not been confirmed yet. So what are the effects of varicocele, or what's the reason for developing subfertility? Basically what's happened due to this varicocele, the testicular dysfunctions cause, then it causes abnormal spermatogenesis. So why? Stasis of blood, increased testicular temperature, abnormalities of the testicular blood flow, renal reflux along the left testicular vein, accumulation of free radicals within the dilated vein, and abnormal apoptotic activities. There are a lot of theories, but the most important thing, none of them have not been confirmed yet. Probably it's something multifactorial. Then, so this is something about the varicocele. Then, what are the effects, or what are the effects of varicocele on seminal fluid parameters, or how this can cause subfertility? That's the main problem. And the this is, I mean, the highly controversial topic. Stu and colleagues noted various abnormalities in the sperm motility, viability, and morphology in patients with varicoceles, but not in the concentration, volume, and pH. But Ali and his colleagues didn't notice any significant difference of normal morphology or anything. Then the Mohammed and his colleague reported sperm reduction in sperm count, concentration in patients with varicocele. Then the Osifo and his colleague reported low seminal volume, but none of them have not been recognized by the community, and the effects of varicocele on seminal fluid parameter is a highly controversial area. So my objectives, these are my objectives, to find out the association between presence of varicocele and seminal fluid parameter abnormalities in Sri Lankan population, then the effects of varicocelectomy on seminal fluid parameters, because the effects of varicocelectomy in correcting seminal fluid parameters and improving pregnancy rate also controversial. Even the latest EU guideline, which have which has been published in 2012, has not exactly recommended varicocelectomy for patients with varicocele. It's a highly controversial area. The methodology, the study was conducted in Reproductive Biology Laboratory, Faculty of Medicine, University of Ruhuna Gaol. Still, we are conducting the research, and this is a part of the small part of the research. So there I am presenting 37 subjects. So 37 subfertile male who fulfilled inclusive criteria were recruited to the study with their consent. So these are the inclusive criteria which I used. Presence of varicocele confirmed by ultrasound scanning. Then the patient's age should be between 25 and 45. Normal reproductive and thyroid hormone profile. Then the normal testicular volume, and primary infertility for minimum of 2 years. I didn't include patients with secondary infertility. As a method, what I did actually, I got this sample, then did preoperative seminal fluid assessment according to WHO guidelines 2008, but actually 2010 is available, but I started this research around 2008. Still I am conducting, so at that time this is the available guideline, so I adapted that. Then the varicocelectomy is done using an inguinal approach. Colonel Seniviratna did all these surgeries, so technical details of surgeries will be answered by Colonel Seniviratna. Then after that, for post-operative seminal fluid assessments were done after four months of the varicocelectomy. Then all the couples were followed up for a period of 2 years, sometime more. Then the result, mean age of the study sample was 35.4. Then the 32 had left-sided varicoceles, 5 had bilateral varicoceles, and 2 had right-sided varicoceles. So the distribution very well matched with the published data. We also had the right-sided varicocele less amount. So from our sample, 9 had grade 3 varicoceles, then the 15 had grade 2 varicoceles, 8 had grade 1 varicocele, and 5 had subclinical varicoceles. Then the this compares the seminal fluid parameters are pre and post